If you've ever had that nagging low back pain, or maybe that sharp shooting pain down your leg we call sciatica, you've probably noticed something. Everyone has an opinion on how to fix it. I mean, it's one of the most common things people go to the doctor for, but the advice you get can be all over the place.
Right? It's completely overwhelming. One friend will swear by a certain stretch, your social media feed is probably showing you ads for some new gadget, and then your uncle chimes in, insisting you just need to lie perfectly still for a week. You're stuck in this maze of advice, and honestly, it can feel impossible to figure out which way to turn.
You end up feeling like you're just drowning in this sea of contradictory opinions. And all that conflicting advice, it can be just as frustrating as the pain itself. So, how do we find some solid ground here? How do we figure out what's real and what's just noise?
Well, that's what we're going to do today. We're going to cut right through all of that noise and go straight to the source, the official NICE guidelines. This is the playbook used by doctors and physical therapists all across the UK. And this isn't based on opinion or the latest trend, it's a guide built on a massive review of scientific evidence. In other words, this is what the data says actually works.
So where do you even start? Well, the guidelines are super clear on this. Before you even think about treatment, the very first step is getting a proper assessment. Because not all back pain is the same, and your treatment plan absolutely should not be a one-size-fits-all solution.
And this is where the modern approach gets really smart. It's called a stratified approach. Just think of it like a triage system for your back. A healthcare professional figures out if your pain is likely just a short-term thing or if you're at a higher risk of it becoming a long-term problem. If you're low risk, simple advice to stay active might be all it takes. But if you're in that higher risk group, you get more intensive support, like a structured exercise program right from the get-go.
And here we go. Our first big surprise of the day. We've all been kind of conditioned to think, I need a scan, I need to see what's wrong, right? But the guidelines are very clear. For most people, X-rays and MRIs are not recommended as a routine first step. And you might be wondering why. Well, it's because they rarely change the treatment plan. And even worse, sometimes they show normal age-related changes that aren't even the cause of the pain, which can lead to a whole lot of unnecessary anxiety. So we know that routine scans are out, but what about treatments? This is where the guidelines get really interesting because they are so specific about what not to do. And believe me, some of these are probably going to surprise you. Let's kick things off with a big one, acupuncture. I know, it's incredibly popular, but despite how common it is, the evidence reviewed by NICE just didn't support recommending it for either low back pain or sciatica. So officially, it's off the list.
Next up, let's talk about physical supports. Things like those big back belts, corsets, or even special inserts for your shoes. Again, these are not recommended. The thinking here is that we should be building up our body's own internal support system through movement and strength, not relying on an external prop to do the work for us.
What about traction, the idea of gently stretching the spine? This treatment has been around for a very long time. But when the experts really dug into the evidence, they found it just doesn't hold up. So that's another one that's not recommended.
And that same evidence-based thinking applies to all those electrotherapy machines. Common treatments like TENS, ultrasound, pens, they're also not recommended by the guidelines for managing either low back pain or sciatica.
So let's just recap that, because it's a lot. A whole bunch of common treatments that people often spend a ton of money on are explicitly not recommended. Do you see the theme here? The evidence just doesn't support these passive treatments where something is done to you. The focus is shifting big time.
So after that long list of don'ts, you're probably thinking, well, what are the do's? Let's get to the good stuff. Let's talk about what the evidence actually supports. This is the real core of effective back pain management.
And here it is, the absolute foundation, the cornerstone of managing back pain and sciatica, is movement. That's it. The goal is to encourage you to stay active, to keep up with your normal life as much as you can, and to take part in a structured exercise program. So bed rest is out, activity is definitely in.
And the best part is you have options. It's not just one specific type of exercise. It could be about strengthening, it could be aerobic stuff like walking or swimming, or it could even be a mind-body approach like yoga or Tai Chi. The key is finding what works for you and then doing it consistently.
Now, this next point is so important. It highlights a really critical distinction. What about things like massage or spinal manipulation or even talking therapies like CBT? Well, the guidelines say these should not be offered as standalone treatments. And this is a big but. They can be considered, but only as part of a package that has exercise as the main event. Think of exercise as the star of the show. These other therapies are the supporting cast.
Let's talk about a huge piece of this puzzle: medication. The guidelines here are extremely specific, and it is crucial to understand this. The advice for general low back pain is different than the advice for sciatica. That is, that specific nerve root pain, also known as radiculopathy.
Let's walk through this carefully. For your general run-of-the-mill low back pain, paracetamol on its own is no longer recommended. Anti-inflammatories like ibuprofen can be considered, but only at the lowest dose that works, for the shortest time possible. For chronic low back pain, opioids are a no-go. Now, for sciatica, the warnings are even stronger. Again, no opioids for chronic cases. And this might be the biggest shock for some. Common nerve pain drugs like gabapentinoids are explicitly not recommended because the evidence actually points to a real potential for harm with very little benefit.
All right, finally, let's talk about the most invasive options. People always ask about surgery, but the guidelines reserve it for very specific situations.
For general low back pain, the kind that isn't caused by something specific like a fracture or a tumor, the guidelines are incredibly firm. Invasive procedures like spinal injections, spinal fusion surgery, or disc replacements are not recommended. Period.
But there is an exception when it comes to sciatica. If someone is going through a really acute and severe bout of sciatica, an epidural injection with a local anesthetic and a steroid can be considered. The idea is to help calm things down in the short term.
And what about actual surgery? Well, for sciatica that just isn't getting better with a good, dedicated exercise program and other non-surgical options, spinal decompression surgery might become an option. But it's so important to stress this is only considered after a thorough trial of everything else has failed to bring relief.
And this final idea really gets to the heart of the entire guideline. The whole modern evidence-based approach has moved away from looking for some kind of passive cure or a quick fix. Instead, it's all about empowering you with the knowledge and the tools centered around movement and activity to take control and manage the condition yourself. It completely reframes the goal. So the question is no longer just, what can fix my back, but rather, how can I actively be a part of my own recovery?